Have you ever gone to bed believing you were doing everything right for your health, eating better, taking your medications, trying to stay active, and yet you wake up exhausted, puffy, stiff, or with a dull ache in your lower back, and no clear explanation for why most people brush that feeling off? They blame age, stress, or poor sleep. But what if that discomfort is actually a warning your body is sending one that almost no one recognizes until it's too late? What if I told you that the most serious damage to your kidneys doesn't happen during the day at all, but quietly, repeatedly, every single night while you sleep? Not because of disease, not because of genetics, but because of small nighttime habits that feel harmless, routine, even healthy, and are repeated night after night without a second thought. Here's the part that should make you stop and listen closely. By the time most people are told something is wrong with their kidneys, more than half of their filtering ability is already gone permanently. There is no sharp pain, no dramatic warning sign, no moment where an alarm goes off. The damage builds silently in the dark while you believe your body's resting. I'm Dr. Richard Hale, and for over 2 decades, I've watched patients sit across from me in disbelief asking the same question over and over again. How did this happen when I felt fine? And the answer is almost always the same. It didn't start with illness. It didn't start in a hospital. It started with what they did or ignored right before bed. Tonight, I'm going to show you 5 common nighttime habits that quietly destroy kidney function habits millions of Americans are doing right now without realizing the danger. More importantly, I'll show you how to stop the damage and begin protecting your kidneys starting tonight using simple, realistic changes grounded in medical science. Stay with me because once you understand these hidden triggers, you'll never look at your bedtime routine the same way again. The first nighttime habit that quietly damages your kidneys is one almost everyone considers harmless, and that's eating salty foods before bed. I'm not talking about fast food binges or obvious junk meals. I'm talking about the small bowl of chips, the buttery popcorn, the just a little frozen dinner, or the handful of salted nuts you grab while winding down believing it's no big deal. Most people never connect that evening snack to kidney problems because the effects don't show up immediately. They build silently. I remember a patient named Robert, 62 years old, a retired construction worker who genuinely believed he was doing everything right. He had quit smoking, stopped drinking, soda walked every morning, and even lost weight. When I asked about his evenings, he smiled and said, "Nothing crazy, doctor. Just some popcorn or salted peanuts before bed." His blood work told a different story. His blood pressure had been creeping up, his ankles were starting to swell, and his kidney filtration was under strain long before he felt sick. Here's what's actually happening inside your body. Sodium pulls water into your bloodstream. The more salt you consume, the more fluid your body holds on to. That extra fluid raises pressure inside your blood vessels, forcing your kidneys to filter harder. Think of it like asking a water pump to push against a partially clogged pipe night after night with no rest. Over time, that pressure damages the delicate filters inside the kidneys. According to the American Heart Association, adults should consume no more than 1,500 milligrams of sodium per day. One innocent bowl of buttered popcorn can contain nearly half of that. Add a sandwich, canned soup, or a low-calorie frozen meal, and you've exceeded safe levels before your head even hits the pillow. What makes this especially dangerous at night is timing. While you sleep, blood flow naturally slows, and your kidneys are supposed to shift into recovery mode. Flooding them with sodium at that moment forces them to work overtime when they're least equipped to do so. That's why nighttime salt intake is strongly linked to rising blood pressure and progressive kidney decline, even in people who eat relatively well during the day. The good news is this is one of the easiest habits to fix. Keep your evenings light. Swap salty snacks for fresh berries, apple slices, or a small portion of unsalted nuts. And don't trust labels like light diet or healthy. Always check the sodium line. That's where the real danger hides. Now, if you're listening to this and thinking, "I'll just cut back on salt and I'll be fine," pause right there. Because knowing this alone isn't enough. There's another nighttime habit one that many people believe actually protects their health that can put even more strain on your kidneys while you sleep. And that's what we need to talk about next. If you've decided to cut back on salty snacks at night, that's a powerful first step. But here's where many people make a dangerous mistake. They replace salt with something they believe is healthy, something doctors, trainers, and social media have praised for years. Late night protein, a shake before bed, a large portion of chicken or fish after an evening workout. It feels responsible. It feels disciplined. But for your kidneys, timing matters more than intention. I once treated a patient named David, 58 years old, lean active, and proud of his clean lifestyle. Every night right before bed, he blended a large scoop of whey protein with almond milk, convinced he was helping his muscles recover while he slept. At first, nothing seemed wrong. Then he began waking up exhausted, his eyes puffy, his focus gone by mid-morning. When his labs came back, the truth was clear. His creatinine had climbed, and his GFR had dropped nearly 20% in less than a year. Here's the science most people never hear. Protein itself isn't harmful, but when your body breaks protein down, it creates nitrogen waste. That waste has to be filtered out of your bloodstream, and your kidneys are the only organs capable of doing that job. During the day, your circulation is strong, you're hydrated, and your kidneys can handle the workload. At night, everything slows down. Blood flow drops, filtration efficiency decreases, and yet when you consume a large protein load right before sleep, you force your kidneys to work overtime precisely when they're supposed to be resting and repairing. It's like asking a factory to run its heaviest shift during scheduled maintenance. According to research published in the Journal of Renal Nutrition, people who concentrate large amounts of protein into a single meal place significantly more strain on kidney filtration than those who spread intake evenly throughout the day. This effect is even more pronounced in adults over 50 and in anyone with diabetes, high blood pressure, or early kidney disease. Over time, that nightly overload can quietly accelerate kidney decline, even in people who appear outwardly healthy. The solution isn't to fear protein, it's to respect timing and balance. Aim to distribute protein across your meals roughly 15 to 20 grams per serving, rather than 40 or 50 grams late at night. Choose options that are easier on the kidneys, such as lentils, tofu, quinoa, or lean white fish. And never forget hydration. Water is your kidney's silent partner in clearing nitrogen waste efficiently. If you're unsure how much protein your kidneys can safely handle, don't guess. Ask for lab work. Let your GFR guide your intake, because this habit doesn't announce itself with pain or warning signs. It shows up quietly on a blood test long after the damage has begun. And just when you think food is the main battlefield, there's another nighttime behavior, one that has nothing to do with eating at all, that can undo every healthy choice you've made before bed. Up to this point, we've been talking about what you put into your body at night. But there's another habit that quietly damages the kidneys, and it has nothing to do with food at all. It's something many people do out of convenience, comfort, or simple exhaustion. Holding your urine overnight. Maybe you don't want to get out of bed. Maybe the bathroom feels far away. Maybe you tell yourself, I'll just wait until morning. That decision feels harmless in the moment, but repeated over time, it can trigger a chain reaction that permanently scars the kidneys. I treated a patient named Linda, 64 years old, a retired school teacher who hated waking up at night. She had trained herself to ignore the pressure and sleep through it. For months, nothing seemed wrong. Then she developed persistent fatigue, lower back pain, and a fever that wouldn't go away. When we ran her tests, her urine showed heavy bacterial growth, and her kidneys were inflamed. She had developed pyelonephritis, a kidney infection that started quietly in the bladder. Here's what happens inside the body when you hold urine. The bladder becomes a warm, stagnant reservoir. Bacteria love that environment. They multiply quickly, and once their numbers grow, they don't stay put. They travel upward through the urinary tract and into the kidneys. Each infection, even a mild one that doesn't cause obvious symptoms, can leave behind microscopic scars in kidney tissue. Over time, those scars reduce the kidney's filtering surface, shrinking its ability to clear waste from the blood. Studies show that recurrent urinary tract infections can reduce kidney function by up to 25% in older adults, particularly in women and people with diabetes. And the most dangerous part is that this damage often happens without dramatic pain, which is why so many people dismiss the habit as harmless. Nighttime makes this risk worse. While you sleep, urine flow slows, and your body's natural flushing mechanisms are less active. Holding urine for hours allows bacteria to sit undisturbed, increasing the likelihood that they'll migrate upward. The solution isn't complicated, but it requires a mindset shift. If you wake up needing to go. Keep the path to your bathroom clear and softly lit so you don't hesitate. If nighttime trips are frequent, adjust fluid timing by drinking more earlier in the day rather than cutting hydration altogether. And if you notice burning cloudy urine or sudden urgency, don't self-treat or wait it out. Early treatment can prevent permanent kidney scarring. Many people believe kidney damage announces itself with pain or dramatic symptoms. It doesn't. It accumulates quietly, decision by decision, night after night. And even if you eat wisely, hydrate well, and respond to your body's signals, there's another warning sign most people completely overlook, one that shows up not in the bathroom, but in their legs while they're trying to fall asleep. At this point, you may be thinking that kidney damage would at least warn you with pain, swelling, or obvious lab results. But sometimes the body chooses a different language, one that shows up not in your bladder, not in your diet, but in your legs as you're trying to fall asleep. Have you ever felt an uncontrollable urge to move your legs at night, sudden twitching, crawling sensations, or painful cramps that wake you out of sleep? Most people shrug it off. They blame age, dehydration, or a bad mattress. But for the kidneys, restless legs and nighttime cramps are often an early distress signal. I once treated a patient named James, 67 years old, a retired pilot who came to see me. For one reason only, his legs would not stay still at night. He tossed, kicked, and woke up exhausted every morning. He thought it was a circulation issue or simple muscle fatigue. When we ran his blood work, the real problem surfaced. His electrolyte levels were off and his GFR had dropped to 52, a clear sign of early-stage kidney decline. Here's what's happening beneath the surface. Healthy kidneys carefully regulate minerals like potassium, sodium, calcium, and magnesium. These electrolytes control how nerves fire and how muscles contract. When the kidneys begin to struggle even slightly, that balance starts to slip. Nerves misfire, muscles spasm. The result can be restless leg syndrome, nighttime cramps, or constant leg movement that disrupts sleep. According to research published in the Journal of the American Society of Nephrology, up to 35% of people with chronic kidney disease experience restless legs often before they're formally diagnosed. That's what makes this symptom so dangerous. It doesn't feel like a kidney problem, so it's easy to ignore. But every sleepless night adds stress to the nervous system, raises blood pressure, and fuels inflammation, all of which further burden the kidneys. The solution begins with awareness. If your legs feel restless or cramp more than twice a week, don't brush it off. Pay attention. Talk to your doctor and ask specifically about your creatinine, urine, and eGFR levels. Those numbers often explain what your legs are trying to tell you. Nutrition also matters, but this is where caution is critical. Low iron or magnesium can worsen restless legs, but self-supplementing can backfire, especially if your kidneys are already compromised. Many over-the-counter cramp remedies are loaded with potassium, which can be dangerous for declining kidney function. Instead, focus on gentle dietary sources like leafy greens, small portions of fish and unsalted nuts, and let lab results guide any supplementation. Your legs are not the problem. They're the messenger. When they can't rest, it's often because your kidneys can't keep balance anymore. And if you think listening to your body's signals is enough to protect your kidneys at night, there's still one more mistake. Almost everyone makes one so common and underestimated that it can decide whether kidney damage stabilizes or spirals out of control while you sleep. If you've been listening closely, you may feel like you finally got control. You're watching salt. You're timing protein better. You're listening to your bladder and paying attention to your legs. But there's one final nighttime mistake that quietly undermines all of those good choices. And it's so common that most people don't even realize they're doing it. Going to bed dehydrated or drinking the wrong fluids before sleep. I've lost count of how many patients told me I drink plenty of fluids at night only to discover that what they meant was tea, coffee, soda, or a glass of wine. I remember a woman in her 70s, the grandmother of a patient who came in complaining of morning headaches, stiffness, and overwhelming fatigue. She proudly told me she drank green tea and a little red wine every evening to relax. Her lab work showed something else entirely. Her creatinine was rising, and she was significantly dehydrated. The very drinks she thought were helping her were quietly draining the fluid her kidneys desperately needed. Here's the science most people never hear. Your kidneys rely on adequate blood volume to filter waste. When you're dehydrated, blood flow to the kidneys drops, oxygen delivery falls, and filtration efficiency declines. This creates a condition called pre-renal azotemia, which essentially means your kidneys are being starved of circulation. If this happens repeatedly, what starts as a temporary slowdown can turn into permanent damage. Now add caffeine or alcohol to the mix. Both act as diuretics, increasing urine output and pulling even more water out of your system. Sugary drinks add another layer of harm by spiking insulin, raising blood pressure, and accelerating kidney scarring. According to data from the National Kidney Foundation, adults who routinely go to bed dehydrated or consume caffeine or alcohol late at night face a 30 to 40% higher risk of kidney function decline over the following decade. Not because of disease, not because of genetics, but because of what they drink right before sleep. The solution isn't to flood your body with water before bed. That often backfires. The goal is balance. Hydrate steadily throughout the day, giving your kidneys the resources they need while you're active. For most adults, 2 to 3 liters daily is appropriate unless your doctor has placed fluid restrictions. In the evening, keep fluids gentle and intentional. A small glass of water on the nightstand is enough. If you wake up thirsty, take a slow sip, not a gulp. When you want something warm or calming, choose caffeine-free herbal options like chamomile or hibiscus. These support hydration without overstimulating your kidneys. Dehydration doesn't just dry your mouth. It thickens your blood, strains your circulation, and forces your kidneys to work harder with fewer resources. Night after night, that imbalance adds up. And now that you understand how these 5 nighttime habits work together to quietly damage kidney function, the real question isn't what you know anymore. It's what you'll change tonight, because what you do next determines whether your kidneys finally get a chance to heal. And that's what we need to talk about in the final moments. If you've stayed with me until now, I want you to hear this clearly. Nothing you've learned tonight is meant to scare you or make you feel guilty. It's meant to give you back control. Kidney damage doesn't happen because you're careless or weak. It happens because no one ever explained how quietly it begins or how much power small nighttime choices really have. The fact that you're listening right now tells me you care about your health, and that already puts you ahead of most people. You don't need to be perfect. You don't need to change everything overnight. Real protection starts with one small decision tonight, whether that's choosing water over wine, skipping the salty snack, getting up when your body tells you to, or simply paying attention to a signal you used to ignore. Those small decisions add up, and your kidneys feel the difference long before it shows on a lab report. If this video helped you understand your body a little better, do yourself a favor and save it. Not for me, but for you, so you can come back to it. Replay it and remind yourself why these habits matter. And if you know someone who wakes up tired, swollen, or struggling without knowing why, share this with them. Kidney disease is silent, and early awareness can change the entire outcome. I also encourage you to subscribe to this channel and turn on notifications. I regularly break down the latest medical research into clear, practical steps you can actually use to protect your kidneys and your overall health without fear, hype, or confusion. Your kidneys work for you every second of your life quietly and faithfully without ever asking for credit. It's never too late to start returning that care. Health isn't lost just because you're getting older. It's rebuilt through awareness, consistency, and hope. Take care of yourself, listen to your body, and remember that the choices you make tonight can protect your kidneys for years to come.